indeed a privilege to be here this afternoon at the 5th International Clinical Nutrition Update. I remember distinctly 6 years ago when we first thought of this idea of bringing all the dietitians, first from Apollo, on one platform so that they could talk about the latest in the field of clinical nutrition. And then, of course, it's expanded over the years, and now this is a truly international event. You know, it was said hundreds of years ago, what is food for one can be poison for another. And we clinicians sometimes forget that. But when we forget that, it's not for more than a few minutes that we are reminded by our accomplished dietitians that we are going to do some wrong, and they prevent us from doing that wrong. And because of you, we make fewer mistakes. And to recognize that, let us put our hands together for this wonderful group of talented and accomplished dietitians from across the country. This is indeed a very special conference because Bhuvneshwari was saying that we now have 250 dietitians from 20 states of India. So that, I think, is remarkable progress. The target next year, Bhuvneshwari, is 29 states. We might have 29 by that time. So 29, and of course getting greater international presence. Started this tradition of coming out with manuals and books. We started with adult nutrition, pediatric nutrition, then we came out with a pocket book on adult nutrition the third year, then last year pediatric pocket book, and this year on transplantation. So of course we want to carry on with this tradition, and Bhuvneshwari, we want you and the team really to look at this and create one nice pocket book or manual each year. The topics are really exciting when one looks at the scientific program. We're going to talk about the brain, we're talking about Crohn's disease, we're talking about cancer, we're talking about transplantation, we are talking about cystic fibrosis. We then talk about protein metabolism. Then Professor Anand Pandit is going to talk about the thin fat phenotype, which is really an exciting area. And then you're also going to talk about fat metabolism. Many of us are dying to hear how is it that we can burn a little bit more fat tomorrow than we did today. So the program's really exciting. I'm sure the deliberations are going to be very meaningful, interactive. I just want to end by saying with one request. President Roosevelt had said, do what you can with what you have where you are. Just want to request you to do one thing, and that is if you can arrive at a Hyderabad declaration on clinical nutrition. Just keep it simple, 3 points. Every hospital should have a clinical nutritionist. Every patient who's admitted should have a nutritional assessment, and a clinical nutritionist should be, or dietitian should be a part of the multidisciplinary team. And if you did that, you'd make such a big impact. And we've actually learned over this past year. In January, we had the Chennai Declaration on managing infections. This has now been published in most international journals. Everybody's looking at this seriously. Last month, when we met here in Hyderabad, we had a patient safety declaration, and that really talks about a charter on how to make our healthcare facilities safer. And if you can come out with a Hyderabad declaration on clinical nutrition, I think that will make a big difference. And perhaps next year, when we all meet in Bangalore, and that's where the next conference is going to be, you can all look at with satisfaction saying you made a difference, and you can actually make a big difference. And I'd like to conclude by saying, we clinicians always get the credit for everything good that happens to the patients, but quite often the doctor actually makes a very insignificant contribution. It's the nursing staff, the physiotherapists, and very importantly, the clinical dietitians who make a big difference. So on behalf of all of us on the clinical side, may we show our deep appreciation and place on record our gratitude to you for the good work that you do each day, 365 days of the year. Thank you very much.